If there's one thing that you would want to focus on and avoid at all costs in your multivitamins and your food and your prenatal, it is folic acid.
As an OBGYN, I feel a lot of responsibility about the information that I put out there, both on TikTok and for my own patients, because the consequences can be huge for their pregnancies and their babies. Folic acid seems to be the big talking point on TikTok, so I want to see what this person has to say about folic acid and what the actual evidence is showing so that you can make an informed decision yourself.
Extremely common to be found in prenatals. OBs still prescribe it.
Years ago, they made the association that pregnant patients who had an increased intake of folic acid had a decreased risk of having neural tube defects in their pregnancy. The studies after that, looking specifically at folic acid supplementation, showed that there's a significant decrease in those neural tube defects for a large majority of patients. Specifically, that 16 to 58% of possible neural tube defects can be prevented by folic acid supplementation. And a recent study is showing that almost an 80% reduction in spina bifida and a 57% reduction in the possibility of anencephaly. That's huge. But these studies are done specifically on folic acid. Folate is that overarching word. Folic acid specifically is what's been used in these studies, and that's why we as OBs prescribe it, and that's why it's found in your prenatal vitamins.
And you're like, how does this apply to me? Let me ask you this. Did you have a baby with a tongue tie? Did you experience a lot of nausea or mood issues when you were pregnant or postpartum? Postpartum anxiety, depression, rage swings, detoxification postpartum.
Those seem like very vague things that you can attribute to the majority of pregnant patients. Have you ever been nauseous? Have you ever had any mood swings in pregnancy or postpartum? Yes, I think probably all of us would say yes to that. But the data saying that folic acid is increasing those symptoms isn't really there. This is a meta-analysis looking at both perinatal depression and folic acid, and they're actually showing that an increase in folic acid decreases your risk of depression. Thing about tongue ties, I found one study about it and saying there's a possible cause, and this is seen as an observational study. This is not a causation study where it's saying increased folic acid does cause a tongue tie, and I think that's a really important distinction to make. When it comes to your baby's development and their brain and their spine forming, I think it's really important that you talk to your own OB provider, someone who is trained in this field, who has the responsibility for your care, and ask them what is best for you. Please don't listen to health coaches on TikTok when it comes to the health of your baby and yourself. Also, if you ask me to choose between anencephaly and a tongue tie, I will always choose, I would rather have a tongue tie. I want my baby to have a brain.